I am Joshua Hyman, and I am the Associate Medical Director for the Weinberg Family Cerebral Palsy Center at Columbia University Medical Center. And today I'm going to talk with you about hip problems in children with cerebral palsy. In general, children with cerebral palsy will have stiffness around the hips, and they tend to develop a typical hip positioning as a result of their spasticity. They will develop hip flexion contractures, adduction contractures, and they will have difficulty with seating as well as bathing and hygiene. This is what we see clinically. What's going on inside of the hip, though, is that the actual bones are changing their relationship, and some of them are also changing their shape. They will develop subluxation and dislocation of the hips over time. Subluxation is where the femoral head slowly comes out of joint partially. Dislocation is where it is out completely. And once that happens, the children develop significant stiffness and pain. As orthopedic surgeons, we have a wide range of options that we can provide children with cerebral palsy. Starting at the very mild end of the spectrum, we can offer them soft tissue operations to release or lengthen tendons around the hip joint to make them move more smoothly. Those children that have more involvement have developed bony changes. We can actually cut the bone, reshape them, reposition the femoral head within the acetabulum, within the socket, and recreate a more normal hip joint. You might not expect that a child in a wheelchair should have to worry about their hips, or that caregivers should have to worry about their hips, but in fact it's the opposite. Those that are in a wheelchair that don't have the ability to walk, they have greater involvement with their cerebral palsy, and as a result they tend to have more severe hip problems. I can't emphasize enough how important it is that we pay attention to hip health in children with cerebral palsy. When we do, we are able to intervene earlier and do less to provide a healthy, comfortable, and functional life for these wonderful children.